Welcome to the regular meeting of the Pipestone County Commissioners. Call the meeting to order. Join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Take two succeeded, okay. Welcome to the regularly scheduled Commissioners meeting, February 27, 2024. Commissioner Luke Johnson, Commissioner Doug Nagel, Commissioner Dallas Roskamp, Commissioner Dan Wildermuth, Chris Hollingsworth is absent. Also present is Steve Ewing, County Administrator, and press and visitors. Any adjustments to the agenda?
Mr. Chairman, I have none.
Mr. Chair, I'll move the agenda as presented.
Thank you. Is there a second?
Second.
And been approved and seconded for the agenda. Any other discussion? All in favor, say aye.
Aye.
All opposed, same sign. Carried. The consent agenda, minutes of 2013-24. Approve the commissioners' warrants, approve of auditors' warrants of 2/16/24, 2/23/24. Approve hospital warrants of $817,374.74.
Jared, move for approval.
Thank you. Is there a second? Also seconded. Any other comments? All in favor, say aye.
Aye.
Oh, same sign. Carried. Nick Bergman, Highway Engineer. Present and accounted for.
Back in the country. Morning.
Morning,
Morning,
Nick.
Nick.
Not a whole lot for me today. Just a few updates. The first one would be first one listed is our County Road 17 project. I'm going to talk about that at our road and bridge hearing next week. I think right after that we'll be advertising, so in case something comes up there that we want to reconsider, but so that's our plan with that. I told you I would look into some selling options for that metal truss bridge. And what I handed out, this is what I got from the state, so if we want to, I would not recommend hauling it to Arden Hills. I would say sell it to the site, so. So that being said, if we were, for items that sell for $625 or less, the fee is $50. If the item sells for 50 or less, surplus services retain all the proceeds. For items that sell for $625 to $4,000, the fee is 7%. And for items that sell for more than $4,000, the fee is 6%. So that's our options if we want to use the, I think it's called min bid, I believe, but otherwise, we could just advertise in our local paper and take sealed bids. Like, I think that's how we sold our last pickup. So I don't really care. I mean, whatever you guys want, it's fine with me. We'll do whatever. So
I just thought this would go out way further,
it would,
and there's not many people that want a bridge.
right?
Probably where our paper goes.
Yeah,
I think it's a good idea to go out further like that. You
Min
can,
bid?
you can do the paper too. If you want,
Yeah.
but
oh, and just direct them to the,
I mean, you could put an ad in our paper
Sure.
besides this, but,
Mhm.
yep. Right.
and I don't know, the cost doesn't seem too bad.
That commission doesn't seem out of line at all.
We have no idea what we're gonna get for it, so.
Right. Yeah, the only thing that I'm not sure on is like, yep, we would have a far better reach, no doubt about it. I don't know if there's much desire for trying to move something that large,
Well, yeah, but if somebody needs one.
or if they really want it, I'm sure they'll figure it out.
And they buy it for $1,000 or whatever, and if they had to build one, it would cost way more than that.
Oh, yep,
They'll pay the transportation.
right. So,
So, my opinion.
Was that a motion or
Sure.
is there support for that?
Yes, I'll second.
More discussion?
Motion for using min bid and also advertising in our local papers.
Next question, is any idea just, I mean, what's it worth just for scrap or?
Nobody knows how much it weighs.
Yeah.
It's so much a ton.
Yeah.
If we wanted to know, I'm thinking we could maybe hire. I think the easiest way to do it would probably be to hire somebody who payloader scales to come out and lift it up with that.
I don't know if it's
I don't
worth
think
that.
that's worth-
You know,
Probably spending hundreds of dollars,
Stick more money.
Right.
And
but we don't have a way to do it
the
ourselves.
scrap people maybe will bid on it anyway.
Yeah.
Mm-hmm.
Do we, with min bid, can we set a minimum bid on that or not?
I think you can, yeah.
I wonder if we should put a minimum on it because of the scrap value. Cause you'd hate to have somebody get it for $50 and then,
Right, right. What do we do?
The only other thing I remember selling on there was that tack truck and I didn't care what we got for that. I just
Right.
wanted to.
Yeah, this is different.
I-
Um,
it's gotta be a couple ton, isn't it?
oh, yeah. Oh,
Bridge has got to, what are you guessing, five ton?
be a good guess. I don't know.
And I
Um,
don't, is steel
But,
up to what?
you
70
know,
a
the
ton?
steel, I'm
Steel, I'm up to,
not sure.
should we just put a minimum on it of $300 to $400 minimum? Sound
Yeah.
reasonable? Or whatever you think, Nick.
Okay, if they still allow us to do that, and if they allow us to put a minimum that low, I will
Okay.
try for $300, but I guess,
Do what you think is right.
yeah.
Yeah.
I guess if I find out that no, reserves start at this high, well, then I might not be able to put one on or, I don't.
And I guess you think about it, if we were to scrap it ourselves, we would have a lot of labor.
That's the thing.
You would.
Cutting it up,
Well,
so.
it depends what else is going on though.
Oh.
Not much else going on and they could cut it up, but.
But again, I think it's more valuable as a whole than it is for scrap, so hopefully it gets used somewhere.
Oh,
So then local paper, just advertise that it's on min bid.
Mm-hmm.
Steve, can you put a link on our website as well too?
Mhm,
direct to people?
absolutely.
Maybe the local paper, I'll just say, check our website for the link to
Yeah,
the,
we do that.
that might
we
be
have
the
a-
easiest way to do it versus trying to spell out a link in the news.
Right.
Okay.
They'll take care of that when we get it ready to go.
Can we make sure that the person locally that's interested gets notified that it's on mid bid or whatever? Cause they won't find it otherwise.
that'd be the paper. They're putting it in the paper.
Yeah, but if he made a request for it.
And
he was gonna
actually, I'll
look
take
at
care of
it.
that myself, because one of the individuals contacted me about it. I'll give him a call, and let him know. it's
Thank you. That'd be
Follow up.
a good,
You're talking about
pardon me?
Kurt Hueskin?
Yeah.
Actually, it was Doug is who contacted.
Doug, excuse me, Doug, yeah. Okay. I talked to him about it too, and he said that the bridge really didn't, really think that would be that worthwhile to try to get it and move it and all that. And what they
Also,
want to do is they, I talked to him after that, said, what's going on? They would end up probably doing something out of wood at their facility anyway, so.
Circles back around again, doesn't
Well,
That's
How that bridge is gone.
Yeah. it's just-
Contacted about once a year on it.
have to sell it either.
it? No, we don't, no. We could paint it white and call it an elephant, huh?
Yeah. So if we get, okay, so just let it go then if it gets that
Well,
300
still-
bucks.
we still want a minimum, right? Yeah.
If we can, if they'll let us put a minimum on, put a minimum of 300 on it,
Okay,
because it doesn't cost us anything to sit out there.
right, right. Okay, if I can't do that, I'll be back to talk about it, cause. Yeah. All right, I'll try the $300 reserve and then, we'll put an ad in the newspaper directing them to our website, which will have the link to the min bid thing. Any? Anybody have any firm feelings on how long it should be advertised? I feel like I didn't have much for options last time. They're just kind of like, well, it's either 2 weeks or 3 weeks, whatever you want. It
We
was
can leave-
something.
We can leave that up to you, whatever
Okay.
they got available. I suppose the longer the better, if they'll let you go a while.
Yep, I would think so, but just so you know, I might not have much for choice on that because I feel like I didn't have much choice last time I did it. It was kind of, here's your two options or
I'd go
something
kind
like
of as long as you could go.
that.
Yeah.
Okay, I'll do
Somebody
that.
sees it.
Okay, there's a motion on the floor. All in favor, say aye.
Okay.
All opposed, same sign. Carried.
Okay. All right, next update, our corner monument grant, our office met with Kyle and surveyor last week. And we, ended up recommending doing Grange Township for that monument thing because they only have one certified corner with, coordinates. So there was a bunch of cases for a bunch of different townships, but in the end, based on what we could get the most bang for our buck out of, we felt that that was the best place to start, so. That's okay with you, we'll just leave it as is, but I think they submitted the letter of
Did
intent.
you
I
get a
don't-
number? How many are certified?
One.
No, total counting.
Oh, shoot, I didn't bring the maps with, but,
Okay.
111, wasn't it? That sound right?
could be, it was really weird because like.
Yeah, it was.
How many, would you say
Just
311, I think is what they found.
six?
Three.
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 311.
And how many are there total?
I think it was like 14.
Okay. I
What
have
was
those
it?
numbers, they're sitting on my desk, I just didn't.
Only about 20% are done, roughly.
Well, there's a difference.
Yeah.
There's some that were certified. And then there was certified with coordinates. So there's a difference there. I feel like you could get about two of them that were certified, updated to certified with coordinates for the price of with coordinates and it was weird because like Osborne Township had a bunch of certified with coordinates on the west and south part. But then on the east side, there's just like nothing there, but then there's also a lot of roads missing out there too. Cause they're through pastures or whatever, so it's just. Situation, you,
So when they do these, are they doing them certified with coordinates? Is that what they're doing?
yep,
And that's what you want in the end,
yes.
certified with coordinates.
We want to be able to punch in GPS coordinates and go right out.
There it is, yeah, okay.
Okay, Mr. Chairman and Board, what Kyle had sent us, total estimated original PLSS corners. Says, please provide the total estimated original general land office PLSS corners in the county. That number is 1504. I'll give you guys a copy of this too and you can have it. And then next one is total certified corners with coordinates, general land office, LOI. Total PLSS corners in the county with existing corner certificates per statute 381.12, which indicate known geodetic coordinates 311. And then the last number is total certified corners with no coordinates. Total PLSS corners in the county with existing corner certificates per Minnesota statute 381.12, which do not indicate known geodetic coordinates, 771.
Apparently you can be certified with or without.
Apparently,
Right,
Were they certified before they were doing GPS coordinates or what? Some of these that don't have coordinates
some of them probably
or
were.
the equipment and type thing?
Yep, I would imagine most of those, that was probably the case, but I'm just guessing. I'm not a surveyor, so. They would record it and say it's like this many feet to this corner
Yeah.
post or this fence line and then in this direction and. They'd have ties like that so you could physically measure it and go
So
right to the
there's
spot, but
771 that need to be done with coordinates.
I didn't write the numbers down.
approximately 771.
Do they know how many?
Corners with no existing certificates, 771. And 311 with existing corner certificates. And the total estimate, 1504 is out there. What they're saying here.
They know how many well, of course, they don't know how much money they're gonna get, do they? They don't know how many they're gonna do because grant,
Right,
they don't know what how much funds are getting?
So if I recall from my brief conversation this morning, it'd be Grange Township and then the 2 north miles of Gray. So from Highway 30 up to the north border of Grange.
Depending on the grant.
Yeah. It's just an estimate. That's what they're trying to do.
Okay.
There's a 2 mile stretch of road up in Altona Township. I think they submitted for too that, that I wanna do a regrade project on. So we would either have to pay for that out of our pocket or we have it included in this grant. So I mean, to me, it makes sense to try to stay out in front of our regrades and have them do all that. So it's not, so we're not paying for it. So. But
Nick, when was the deadline for the grant application?
I think it was last Thursday.
And we got it submitted. Any idea when we'll hear back from it?
I did not hear that. I got just little, I was out all last week, so I just got little tidbits of stuff here and there this morning before I came up here, so.
But in any case, with that real short time frame, good job on getting that grant application in. That
Yeah.
was not a lot of time to put it together. So it's
I think that the surveyor did most of that, so
Mhm.
I,
The next deadline we have, Mr. Chairman and board members, will be the the resolution stating the information that we took action on last time. We'll bring that back and add the numbers to it and then submit that to the state. That isn't due till April.
okay. So, yeah, that's what I know for now. For what it's worth, I feel like there's a lot happening in the southeast coming up, so I kind of wanted to. My first thought was township, kind of spread the love, if you will, around the county, but it sounds like it's easier to set these up from north to south. I'm just the middleman relaying info here, but he thought the northern 3 townships would be tough to start on. Lincoln County should do theirs before we would do our 3, so, like I said, I am trying to think of everybody in the county and spread stuff around, but, Grange is a great spot too, cause it's kind of in the middle and you can kind of build off that, same with Gray, so I'm comfortable with that, so. So. Any other questions on the monument stuff? All right, then my next item, road postings went on yesterday. And if we don't have all of our signs up by now, they'll be up by the end of the day, so. So,
what is the condition of the roads now with such a different winter? They're fairly dry, aren't they?
yeah, they're in pretty good shape. I
Oh.
mean, we've had way worse, so.
There's still some frost down underneath there though. I'm sure it's got to work its way out.
Yeah, and I'm sure there's some spots that'll pop up, but I mean, I can remember years where it's like, ooh, geez, we got bad spots everywhere. I think there's a couple years we had blades in on Saturdays even because it was fit.
Closed roads in the past.
Yeah.
Bad.
Yeah, I mean, it's nothing like that now, so. But, last year we had one we had to close, just kind of came up out of nowhere, or maybe it was 2 years ago, but our blade was just blading down it normally and then he just sunk out of sight, got stuck in the middle of it.
I never know, really.
Yeah, you never know.
You don't.
Cause they told me about it and I was like, what? No way. I want to see this. So I went out there and yeah, sure enough.
It's done, you think you're past that, then all of a sudden things fall apart.
Yep. So like, that's one thing I've learned. You just, you never know.
Yeah.
Never know for sure, but right now things are looking very good, so. Yeah, so. Any other questions for me? Otherwise, that's all I have for right now. I haven't been in the office much since last time I was here, so.
Anybody else?
Get a good vacation.
Thanks, Nick.
It's good, right? Okay. All right. Thank you. Thank you.
We're ahead of schedule, but are you ready, Beth?
That's good.
Welcome to Pipestone County.
Well, let me know it on the southwest Minnesota Prairie. I mean, this is kind of normal for us, isn't it? So, good morning, commissioners.
Hi, Beth.
I wanted to, Lisa, as I heard, that Nick had been on vacation. Lisa, DeBoer is also on vacation. She's in Florida, so she couldn't join me. And I thought, I'm not gonna hold up in trying to get you, up to date on what's going on at Southwest Health and Human Services until she gets back, because, who knows, what will happen in the meantime. So thanks for having me this morning. We started this process 7 years ago, when I came on board in July of 2017. And at that time, we knew that we weren't very fiscally healthy. And I know that that was a concern for all 6 of the counties as we were preparing to move forward and look at strategic planning and our levy dollars. I mean, you put a lot of levy dollars into Southwest Health and Human Services. And so we made it a mission to really get back to you on a regular basis as to what's going on. And I know Commissioner Nagel and Commissioner Wildermuth both sit on Southwest Health and Human Services Governing Board. And so I know that you get information on a regular basis. Commissioner Johnson, I see you on a regular basis, whether that's at AMC, Commissioner Roskamp, we saw one another in September. So I try and, be at least available to you. And if you stop in Marshall, please, stop and see me, because I am willing to provide you with some information. So I'm going to go off from a few things that Lisa had provided in terms of the end of the year. So that would be the end of 2023. We did finish our audit, and actually we had a pretty good audit. I mean, we were at a point where we didn't have a lot in reserves, and that had been an audit exception for us for several years. We'd had a healthy reserve at one time, but you don't build a reserve back over a short period of time. So there's been some due diligence by the executive leadership team as well as the staff within Southwest Health and Human Services. So a few things that Lisa wanted me to point out for you is we at the beginning of December, we had a beginning balance in our checking account of $2,855,000. And we ended at $3,522,000. So again, you're kind of seeing that there's some monies that we're able to put into reserves, which is what we want. As you well know, the state auditor would like to see between 4 and 6 months worth of reserve to ensure that we can continue doing the work that we do. So I think we ended the audit this year with 3.75 months of reserve, which is a good thing for us. So we ended December with an overall cash and investment balance of $14,612,669. When excluding the designated funds, so that would be our collaborative, our insurance, those designated funds that we have set aside, the ending balance for the month was $12,498,769, which is up about approximately 1.9 million from last year. So that's a good thing. When also considering other restricted funding sources, we had MA, the Prime West grant, and then we also had some dollars from the opioid settlement. We have two separate opioid settlements. We've got that opioid settlement dollars, and then we have an opioid allocation that we received through social services. So really, we're up about $1 million when you take into consideration that we had some grants that came in. Our self-insurance fund was at $1,271,164. And that was with a $350,000 transfer. The Southwest Health and Human Services Board made a commitment to staff during the 2024-2025 contract that they would pick up the entire cost of the insurance increase for. So without the transfer, the fund is up about $300,000. So when you look at fund balances then for public health, we have $3,969,890. And with Health and Human Services, our fund balance is at $8,528,879. So if you look at those numbers from a budget perspective, then for the end of the month, with public health, we're 1% over budget for revenues and 3% under for expenditures. So overall to date, revenues exceeded expenditures by about $154,000. Human Services, we were 7% over budget for revenues, And we were right at budget for expenditures. Overall to date, then, our revenues exceeded expenditures by almost $2 million. So that's a good thing. Again, I think that what we're looking at is, we're continuing to look at how are we more efficient? How are we more effective? And are we ensuring that we're billing out at every possible venture that we have? So that become the standard operating procedure for us, is that we ensure that we are billing out for what we can bill out. When we talk about some final budget for 2024, we did sign a union contract for 24-25, and that's in place then. We did see a large increase in our health insurance, about 11.2% increase over our other year. So the cost of the agency was about $315,000 with that increase. We have some open positions, not unlike a lot of other entities, organizations. And we saw some new things come out of the state. We're seeing a lot of grants. For the past, 20 plus years, we've seen allocations. But we're really seeing, and health services, public health has always been kind of grant driven, but we're seeing more social services become grant driven. You have to apply for the grant. You have to have a plan for that grant, and then what your budget is going to look like. A lot of those are no supplanting. So again, it's not to pay for services that we currently have or staff that we currently have. The concern about going to a grant funded expenditure is that what's the sustainability for that moving forward? You hate to start new programs. You hate to hire new staff if you don't have sustainability after that grant is gone. I think we can hope that we will see sustainability, that those grants eventually will become allocations, very much like our SHIP grant. The SHIP grant several years ago, many years ago, 12 years ago, 13 years ago, was a grant, and it's become an allocation now. So we'll see if those things occur, but it's hard to make those decisions not knowing if you have anything beyond that first 2 years, first 3 years. So we're very cautious about those kind of things. When we are hiring those positions, we do inform the staff that this is a grant funded position. And so, some folks are in tune with that, and some people aren't real keen about that. So I think, what we look at is we're looking at some IT expenditures, very much like you guys are. We're very concerned about cybersecurity. There were some big issues up north, with some counties being hacked and losing all of their information. So what happened on Monday of last week is that we separated ourselves from Lyon County. Southwest Health and Human Services has always shared, a server has shared services with Lyon County. But with the increase in cybersecurity issues, we felt it was probably in our best interest to separate and amicably move in separate directions. And so we did kind of separate. We had seen that one of the counties had been hosting 23 counties on their server. And when they were hacked, all 23 counties lost that information. So that's a concern. So we just kind of said, it's time. So Lyon County was gracious. And so we are now separate. I think the concern was emails, the concerns of, staff not turning computers off at night. And, I don't know a lot about cybersecurity, but I think that there are people that are very, very smart, and there are businesses that's what they do for a living, is they are looking at cybersecurity issues. In terms of hacking. So we did that. And so I think we're feeling pretty good. Of course, there's been some bumps in the road already this week and last week. So again, knowing full well that we're separate, we feel very confident that the information we have related to Southwest Health and Human Services is safe as it can be at this point in time. Other things, the levy funding for this year, the formula is based on net tax capacity, population, and the last 3 years of the Seeger expenses. The Seeger expenses are those social services expenses that we have. And so we asked for a 6% increase, which was an increase over last year. So the levy increase then was about 125,000 with that 1% over last year. Total human services funding, levy funding was 13,305,000. So that's a 6%. With Public health, our levy funding, we did a decrease this year. They had 12 months worth of reserves. And so again, that gets to be that tipping point where you've got too much in reserve and you want to make sure that you're not levying for the sake of levying. So we did a one-time decrease of $2.25 per capita. And so, of course, public health looks different than human services. And so we do a per capita decrease. So the last 3 years were held at 14 and a quarter, and we went down to $12. So that's a decrease. They could absorb that through their reserves, and we certainly didn't want to levy when we had a healthy reserve. We have some public health nursing positions that are open. They remain open. It's difficult. I mean, we're a public health entity and certainly we can't. We know that one of our colleagues' daughter just graduated from college and she's going to be making $45 an hour up in the cities and we pay $27 an hour. So that's a pretty big, that's a pretty big swing. So the other thing I think I want to talk to you about related to our budget then, our budget in public health in 2023 was $4,108,000. In 2024, it was $4,818,000. And then human services was $30 million in 2023 and 31.1 in 2024. So a total budget for Southwest Health and Human Services in 2024 was $35,920,354. That's a big budget. So any questions about the budget? Again, we continue to scan the environment for ways we can be more efficient, more effective. And again, then I think what we're trying to do is we're also trying to ensure that we are billing out wherever and whenever we can.
Chair, Beth, and,
Yes.
To illustrate that also, last Friday, I also serve on the finance board.
Yes.
We met with the funeral director.
Yes.
So again, doing our due diligence to make sure that we're taking care of the needs of our people, but at the same time, we're being good stewards of the money. You want to elaborate on that at all?
So I was not at that meeting because I was at a Prime West meeting.
Yeah.
And so maybe you want to elaborate a little bit on it.
But yes,
It's still there.
and again, it does, it is, as you know, it's our responsibility to take care of circumstances, energy and so forth. So, but we want to also make sure that the money is going where it should be appropriately gone to. So we're looking at the policies,
Mhm,
making
mhm.
sure that we're not being used as first resort. We are a last resort when it comes to final disposition of remains. So it's quite an involved process. So I appreciate your staff, how they've worked very diligently on that.
That's a statute where indigent burials or final disposition of remains, was a statute that was put into place many, many years ago. It's the right thing to do to bury your dead. I mean, you can't leave people out there. But also that it was really meant for those folks that had absolutely nothing. And so we have seen an increase above and above and above. And I think last year we paid about $350,000 out in indigent burials. So we kind of looked at our policy, looked at the policies of some of the other counties within the state, and we kind of wanted to align to really focus in on what the intent of that statute was. And so I think that's where we're at, Dan, is we're just, again, saying that families, and indigent burial is very minimal. And so what we were seeing is that families were coming in and adding and adding and adding. And we said, but an indigent burial is when you have nothing. And so if family members have $10,000 to put in to a funeral, and then what they're using us for is kind of the baseline, and then they're adding to it. So the intent of that statute was just minimal. And so that's what we're going to go back to, the original intent of that statute. It kind of, it kind of grows and grows, and then you have to kind of, bring it back to what the original intent is.
And we'll also try to be as fair as we can to the funeral directors as
Absolutely.
well, because they get situations too where
They're doing a service for us.
have
Absolutely.
sometimes as well too, to try to find that balance.
Absolutely. So it's a good conversations to have. Sometimes they're difficult conversations, but that's what we have to have. So we settled our 2-year contract. We moved away from pay for performance for the 2 years. As you know, we've been a pay for performance entity for quite some time. But again, we know that we are not meeting We're pretty low in terms of our starting wages, and we wanted to use a couple years to maybe ramp that up a little bit again so that we could recruit and retain the great staff that we have. So we moved away from pay for performance during this contract period. The intent is to move back to pay for performance in the 26-27 contract period. A lot of folks like that pay for performance, based on the work that you're doing and how you're doing, instead of a blanket statement that everybody gets the same amount of increase. We are looking forward to this legislative session to see what's occurring. There's some things that are out there that are a little wonky for us, and so we're just kind of watching things. It's a quick session, though. You guys know that. I mean, 35 days left in the session. I mean, it is a quick session, and my understanding is that they want to be done and they want to be done quickly. So I don't think we're going to see a lot come out of the session. We'll see. But anyway, I think that it'll probably lay the foundation for next year's session is probably what it will do. So I know that they are looking to make some changes and looking at some of the issues that the unintended consequence of some of those fast bills coming through and becoming law. So we'll kind of watch that. We're concerned about adequate and affordable childcare. We're really concerned. What we're hearing a lot is there's no childcare out there. There's nobody to watch my children. I'm pregnant and I can't find childcare. A childcare provider said to me, 2026, I could maybe find a slot for you. That's 2 years from now. That would be, I'm between you and I'm glad I don't have that issue right now, but I really do respect and hear staff and the folks that come into our doors looking for assistance, that there is not affordable childcare. We know that Rock County has opened up a new pod system in one of their communities, and I do believe that the city of Laverne is in the process of trying to get another system up and running for childcare. So they've had some bumps in the road in terms of, when you do a retrofit, you sometimes have some bumps in the road. So we'll kind of watch that. So we'll see.
I know one of the girls that's gonna run one of the pods.
Oh, really?
Yes.
I'm
She's
really,
excited for it. She's a young lady that just got engaged herself, but
good for her. It's kind of a different way to look at childcare, when you're renting those pods and doing those pods. So.
guess the rent is minimal, so.
Right. I believe you're correct, Commissioner Roskamp. So I think it's going to be, it might be how we see childcare look in the future.
The building that they retrofit.
Yes,
so
they
it
did.
was
Yes, they did.
Brand new construction.
Yeah, was that in the hills?
Hills, yes.
Yeah. So, I mean, I think that that's very exciting.
I think it opens the 1st of the March, so.
Yes, so Friday. I know we're very excited. Of course, then we know in Sioux Falls that Apple Tree Child Care Center, there were 10 of them, and I think they shut down 6 of them. Again, I think it's the labor force and again, sustainability of how much can you charge for childcare before it becomes unaffordable for some of our folks that are working, $10, $12, $15 hour jobs. I know one of our commissioners indicated that his daughter-in-law, who is a social worker up in the cities, was paying $2,200 a month in childcare, and just kind of said, I can't do it anymore. So she's going to stay at home. So I think that we should keep our eye on what maybe we can do in terms of childcare. I think the other thing that we want to keep our eye on is that we entered into an agreement last year with Western Mental Health Center for mental health services. I think it went much better than what Sarah had anticipated. I think they're looking maybe for some more space. Dan, I don't know.
In fact, Sarah and I visited the other day and she's unavailable this week.
Yeah.
But next week she's gonna come down and take a look at some of those other facilities talked about as far as office space.
Yeah, I think
Take
it's.
some other possibilities.
Yeah, I think, the first year was kind of our pilot to see if there was, enough work, which we definitely know that there's enough work. It's just, and she is going to take over the mobile crisis grant, which will start, right now, for Pipestone, it's held by Des Moines Valley. And so that was, again, when you were part of the Southwest Mental Health Center. And so they hold that agreement. And so what we'll do is the grant becomes available in May. So for the next grant period, then Pipestone will be covered then under Southwest Health and Human Services holds is the fiscal host. And so Pipestone will come under Western Mental Health as opposed to Southwest Mental Health Center. So I think that'll streamline things a little bit easier too for folks, and I don't think it will be as confusing then. So again, I think that's been a very good collaboration, a good partnership, and so I'm very happy to see that continue. Nobles County is continuing to try and get a crisis bed, but man, that has been just a trail of tears. I mean, in terms of retrofitting a building and what you need to do and what the state looks like and what the state's looking for. And then, of course, finding somebody that will run that for you. And so I believe they might be close, but we'll see. They have been very tenacious, and I am very appreciative of Nobles County and the work that's been done on that crisis bed facility. Prime West. Interestingly enough, you guys have been a Prime West County forever. And so, I think that our other counties have kind of been wondering, they bought into, Prime West. And I think that I wanted to just kind of, bring some things to your attention. They did, Prime West did do some community reinvestment grants this year. When they have some monies available, what they do is they try and reinvest in the communities in which they have a presence. We're all aware that the dental clinic was one of those that they reinvested in the community, and I know that there are some concerns about having staffing, yeah. And so but it's a great idea in theory, so we're hopeful that we can find a dentist that or dentists that can assist us with that. This year, what we did is we did apply, Southwest Health and Human Services did apply for some monies through Prime West. We looked at areas where we had some gaps in service. And so what we did is we looked at parenting time, doing supervised visits, and Pipestone seemed to be an area where it was kind of we didn't have a lot of resources available. So what we did is we did hire a staff who does part-time work in Pipestone for parenting. And she's been busy. And we, it was kind of our first foray into it to see what the interest would be, whether or not we could keep her busy, and we're keeping that person busy. And so I think that that's a good thing for us, so that we don't have to take our staff to do those supervised visits, provide that parenting education and information. And so that was one of the things we did. We also then hired a resource navigator. One of the things we know is that sometimes it's very difficult to navigate the systems, whether that's medical assistance or that's WIC or that's SNAP benefits. I think just looking at the applications themselves, I think it's very difficult for folks. And I think that they get very frustrated. And of course, our staff by law can't say, well, we want you to go on to Prime West. I'm going to help you apply for that. So medical assistance is we want people to be healthy. So of course, being on medical assistance or on one of the managed care organizations is very important for us. So we hired a full-time person to do transporting of kiddos, because probably shouldn't have our social workers doing that when they can be out doing social work. Helping people navigate that system in terms of, here are some resources. And if we don't have them at Southwest Health and Human Services, where can you get those resources? We were concerned because this is a new position. We've talked about it for a long time. I know in my previous life, I know that a county nearby had utilized additional. We have, this person is busy. She's busy full-time doing resource navigation, whether that's helping people fill out applications, going to interviews with them to ensure that they have all the documentation that they need, providing rides for our kiddos that have supervised visits, those kind of things. And so it's a good investment for us. And so again, that was a grant that pays for her entire salary and benefits. It's a 3-year grant. All three of these were 3-year grants. Again, to kind of look at whether or not there's going to be some sustainability there. Especially a resource navigator, the return on investment and return on value is something that probably, even without funding, we would probably want to maintain that. And the third thing that we looked at was reflective supervision for staff. We know that staff have hard jobs. And again, knowing that there are ways that you can handle things, and how do you do self-preservation? How do you have that good life-work balance? And how do you have a safe place to go when you've had one of those really bad days where we just have bad things happen sometimes. And so, we did that, and I believe that that's been very well received by staff. We had piloted it with, our child protection supervisors, and we did extend it out to all of our staff. With that being said, we also then, UCAP, which serves, our counties, made application for a Prime West grant for secure transportation. We know that getting secure transport is not an easy task, and so, they had a 1-year grant to purchase a vehicle and provide, a healthy stipend then to, a driver that would provide, secure, transportation. Of course, that's a good thing for us, that it keeps law enforcement on the road doing the things that they need to do and not be transporting folks, to facilities. So we'll see how that works out. Again, we'll keep you up to date on that. A couple other things then is, looking at Prime West, targeted case management hits. I know that that's, important for, us to understand what our monthly, reimbursement rate, for children's mental health targeted case management. In 2023, our monthly hit was $742 a month. It went up to $1,009 this year. Again, so that's a good thing, and we can do monthly hits on our, children's mental health folks. Yeah, in adult mental health, we saw it go from 437 a month to 608. So, and when you compare that to our other, managed care organizations, 510, 764, 706, and 416. So they are significantly higher than what the other managed care organizations are. I was at a meeting, with Prime West, Friday. We've kind of seen a decrease in folks that have, are utilizing, Prime West. And because Prime West is, you're the single source there. I think what it is those unwinding, or the mitigation of medical assistance. You're probably aware that during the pandemic and in the years beyond the pandemic, that people stayed on MA. They didn't have to do reviews. They didn't have to provide verification of work or assets or those kind of things. And so now here we are in 2024, getting ready for 2025, and we're asking people to come in for their appointments to provide that documentation. So I think that there are some folks that are going to fall off, because that 4-year period where you didn't have to do any reviews, probably was a little bloated. And so, in January of this year, we had, 1,983, enrollees in Prime West, which, is down a little bit. Our highest month would have been March of last year with, 2,234. So I think, in talking with, Prime West staff last week, they're going to be doing, some marketing. I think, for us in Pipestone, we know Prime West, it's a known entity to us. But I mean, I think probably for our other counties, I don't think our numbers are as high as we thought they were going to be, but I think, I hear things like, oh, I have to choose my managed care organization. I'm going to choose Blue Cross Blue Shield because I know them. Prime West really doesn't have, brand recognition, I think, in the other 3 counties that are part of the county-based purchasing. And so I think that Jim is going to put, a significant amount of money into, marketing. I said to him, I said, are you going to use TV? Because boy, oh boy, I sit down and I watch the Twins game and I'm seeing Blue Cross Blue Shield. I'm seeing Humana. I'm seeing all those big ones. And so I know that's pricey, but that might be a good investment. So they're going to be doing some billboards. They're going to be doing some posters. So you'll probably see some things out and about, related to Prime West. Of course, there's some legislation right now, related to, county-based purchasing. It's going to be called Karma, as opposed to which is, it's going to be county administered rural medical assistance as opposed to community-based purchasing. And so I think it's going to be it's a little bit different model. It's, I think, a clearer, more efficient and more distinct and innovative model, when you talk about it related to county-based purchasing. So I think it's going to more closely embody, the legislature's original intent of county-based purchasing. With that being said, we do know that that the lawsuit is at the Supreme Court. My understanding is that we should, that they have until the end of summer, I believe, to review all the briefs. And we can anticipate that there will be, a decision made, I believe, in October. What that means is that it won't be for 2020 calendar year 2025. It would mean if we become a single source in all of our counties, that it would be January 1st of 2026 that they would become single source. So a lot going on right now. And so I don't know. I'm trying to think if there's anything else you want to know. We're going to be holding a new commissioners, new board member orientation on May 15th. If you want to come and you want to hear more about the work that's being done, certainly feel free to come. We'll provide lunch. It'll be immediately following our regular board meeting in May. And so it's a good opportunity to hear with the acronyms. It's a good opportunity for you to hear some of the work that's being done. So I have probably, yeah, I'm over my time. So thank you, thank you. Any questions? I could talk forever. So, and I see you have to. So,
One quick question, Beth, with Southwest 18 Mental Health Consortium,
yeah.
the joint powers, I saw they sent out a new proposal for that. I didn't get a chance to study it. Did you?
I was not at the last meeting.
Yep.
I was on vacation.
But in conjunction with that, as you guys know, Des Moines Valley, who has been the fiscal host, remember, we had to go through that whole thing with our attorneys. They have now decided that they no longer, they've lost their employee that did their bookkeeping. He's retired. So they've notified us that they no longer got fiscal host. So that's another obstacle we got with this.
McLeod County has indicated that they will
McLeod's
take
gonna
it.
step up, okay.
McLeod,
I
but they
hadn't
have
heard that.
they have some caveats to that. So, I mean, I think that there will be some things. I do believe that, we're looking at the joint powers agreement to ensure that the joint powers agreement, meets the needs of all 18 of those counties. I don't think I think they wanted it to be done quickly, and I think when you're dealing with 18 counties, 18 county attorneys, 18 county boards, I'm hopeful that we'll have it done before 2025. So, I think that, Dan, I think it's gonna be, the deeper dive is gonna be a deeper dive, and I think it's gonna take us a little bit of time. And I think we should. I think when opportunities present themselves like this, and probably you know that part of that issue was Lincoln Lion Murray signed on with the Southwest 18 Consortium. Well, Lincoln Lion Murray has not been an entity for quite some time. And so it really was a null and void JPA. And so again, at the end of the day, should Lincoln Lion Murray have even been participating or receiving any of the services. So I think what you do is you reframe this and say, this is a great opportunity that has presented itself. It's time after, 12 years to look at that JPA. Does it meet the needs of all of the counties? And if not, maybe it's not a Southwest 18, maybe it looks different. And maybe the JPA, the board looks different. Maybe it isn't comprised of the folks that are currently on the board. So we'll see. So I know I have a Zoom meeting on Friday related to that. So, yeah.
Back up to speed on it, but there's changes and.
Changes afoot, changes afoot. So the only constant we have in our life is change, right? So it is what it is until it isn't. I can give you lots of little vignettes. So, any other questions?
Anybody else? Thank you for the work that you do.
Thank you for
Appreciate you.
supporting us. I do appreciate the support that I receive from Pipestone County. It's been great. It's a good collaboration. So thank you very much. And if you ever have any questions, Steve, feel free to
absolutely.
reach out anytime and I'll get you the answers. If I don't have the answers, I can find them. Thank you, you guys.
Yeah, thanks, Beth.
Just a little tidbit, Nancy and I got together and we got the vinyl lettering changed on the building out
Oh,
there.
you
So,
did? Okay.
so it doesn't say,
Yeah, what did it
it's
say?
Lincoln Lion Murray
Lincoln Lion
Pipestone.
Murray.
Yeah.
Yeah, that's been quite a while.
So
since.
it's been changed to Southwest Health and Human Services on the door now.
And thank you for that.
Yeah,
Steve.
she asked if we would change the building. It's the public services building. I said, no, we won't
No.
do that. No, the
Absolutely,
building
you
is the
should.
building, but
That's right.
we've updated it and taken
For the
care of
door
that,
to-
so.
The door is accurate.
The
now,
door is
so-
accurate, yes. So people know where they're going.
Thanks, Beth.
Thank you. Thank you.
Is the tax abatement time sensitive?
No,
Amanda, are you ready?
particularly.
Morning, Amanda.
So we received a request from Lloyd's Wart. And so I provided you with the location, the building permit, and the house plans, so you can review. The assessors and I both had looked at it and nothing jumped out at us as far as disqualifying it from our requirements. But if there's something that you guys see, I'd like you to check that out. It looks like, so at this point, we're just reviewing it and we're gonna schedule the public hearing. Due to the publication requirements, we'd probably be looking at having the public hearing on March 26th as opposed to the next meeting. We'd have to go to the one on the 26th to meet the number.
Posting requirement.
Have to have posting requirements.
So,
And is that going to work for the Zwart family?
so yeah, I asked Lloyd when he dropped it off and he said basically he was kind of gonna work whenever he got the approval and stuff. So
So that extra week delay is not gonna be a huge encumbrance for him.
that's why he kind of got it in right away. To be honest, it's still, when I got the application, it was still in the city of Edgerton's name because he had just signed the paperwork to get it in his name the day before, so. But that has gone through, so.
Is there any limitation on how many times you can apply for tax abatement?
I don't see anything
Good point.
on our application as
I
far
would
as that.
assume he's getting tax abatement on the house that he has already.
I would say, because I recall having done some abatements through the Zwart
But one
family.
last year, that's not sold yet. so-
Yep. So generally, with the tax abatements, with his case, he usually builds them and applies for them, but then someone else purchases the property and then at that point, then they're the ones that get the tax. The abatement doesn't start immediately. The assessors,
When does it start?
it starts after it's been completed, and completed means the assessors say that it's completed in their system.
Okay.
So it generally is at minimum of a year, if not more. So I actually have some of those from before here. Now, like, okay, let's just look here at the items that I paid. See, this one that I actually have printed out, we started, the abatement start year here, yeah, 2023. The applications were actually in 2020 and 2021, and their first payment was in December of 23. So, the 2022 start years, those ranged there was actually some from 2017, 2019, and 2020. So it does take a little bit of time
Time before it starts.
payments start.
Any other questions?
So we need to set a public hearing date. So, Mr. Chair, I'll move that we set March 26th. What time, Amanda, you think 10 o'clock?
10 o'clock, yeah.
10 o'clock
10 a.m.
then
again.
for the public hearing and for the tax abatement for the Zwart family.
Okay, is there a support for that? Luke supported it. Any other questions, discussion? All in favor, say aye.
Aye.
All opposed, same sign. That carries.
Wonderful. One other item I do have is we have the presidential nomination primary election next week. We will be doing the canvas board. My plan is to do that on March 7th. So we need 2 commissioners to be on that.
Sure, I haven't done it for a while, so,
I've done it before, so I don't.
yeah.
I won't be here on
Versus I have, so I'm
I
willing
could
to.
do it.
Okay, Doug and Dan. Okay, so again, I will go ahead and let you guys know for sure. And if something does come up, then we can deal with another, but. Wonderful.
Thanks for volunteering.
Not too tall.
We could volunteer Chris, but
Wonderful.
anything else for us today?
That is all I have.
Thank you. Mr.
Is
Steve,
is that in the evening or when is it?
No, it's gonna be in the afternoon.
We had Prime West that day. Oops, you say March, but no, I'm sorry, which,
The,
was the
the
date?
canvas.
yeah, what was the date again?
I don't-
seventh, March seventh.
Yeah. we had Prime West that day. We're both at that.
I can do one.
Yep,
Okay, scratch that.
yep, sorry about that. I
Okay.
missed that. Thank you, Doug, for catching that conflict.
And Chris?
Will they let me know when and where?
Yeah.
Maybe they can use me too. I can help if that's okay with them, so,
Okay.
too.
I helped run elections for 20 years in the township, so. It's always interesting to,
And she, I don't know if she's got latitude on when she does the canvas. If the canvas has to
no,
be on the
there's a
7th,
time. there's
it
a-
has to be within a
you
certain period of time of
Can't delay
closing.
that. It has to be emailed back to the state.
Yep.
That it's,
I didn't know if we could do it on Wednesday instead or not.
I don't know that she'd be totally ready by Wednesday.
Mhm.
It's a compilation they have to do for that. So Thursday, March.
7th.
I'll check with her, and if I can't do it, I'll,
not allowed to do it, you mean?
Huh?
If you're not allowed to do it, you mean?
I'm not allowed to do it, so we'll see if I can, I will. If not, I'll,
Appoint you commissioner for a day.
why not?
Change your name to Chris.
Okay. Chairman, next business we have is at 10:30. I'll be going into closed session on that. We do have personnel items. I have the 2 union contracts for approval, plus your committee reports yet.
You wanna start the labor or?
Sure. Whatever you want to do.
Let's take a 10-minute break then. We're back in session. Union contracts, Steve.
Chairman, I have in front of you the 2 union contracts with AFSCME, one for the courthouse unit and one for the highway department local. I did provide you with copies of the markup so you could see where the changes were, and I highlighted them on that. And you want to take a review of the highway department one first. That just says Council 65 on it. It's a little bit heavier lettering on it. The font is first change, if you're looking through it, is on page 3 under accounting position. That position will start at 7:30 in the morning and end at 4 PM with their half-hour noon lunch. So that was originally at 8 to 4:30, and that was negotiated to start that at an earlier hour. Item E, by mutual written agreement with the highway engineer designee, an employee may be authorized to flex their workday up to 2 hours at the beginning or ending of a workday. Provision is not subject to grievance procedure. So if somebody needs to obviously flex their time, so you start earlier or work later in that accounting department, they can do that. Page 4, change there was adding holiday Juneteenth to item 6, holiday provisions. Page 5, vacations. Vacations were brought together through all the different unions of the county so that all would have the same. So the former was actually a 0 through 5 years. Now it's 0 through 6 years for 8 hours per month, 7 through 10 for 10 hours a month, 11 through 16 years, 12 hours per month, 17 plus, 14 hours a month, and 23 plus is 16 hours per month. So it just brought everything together with the other policies we've got
Excuse
for
me, Steve.
vacation. Not
The
correct.
copy of this contract, we're missing every even numbered page.
Every other page. Yep.
Really?
Yep, I don't have 4, I don't have 6.
Okay, let's stop. I didn't do that. All right. Pause.
I thought it was just me.
Nope.
Okay,
Yeah,
okay. Fortunately, there was nothing on page 2, okay? So page 4, we had Juneteenth was added to the holiday list and all the contracts. Vacations, that was on page 5. We did that one. Page 6. Item number 5. Vacation time can be used in 15-minute or 0.25 hour increments versus the former 30 minutes or 1/2 hour increments. Page 8, I think it was just a numbering issue. There is nothing on the contract for that. Item number 9.0, employees with at least 120 hours of vacation time accrued may cash out up to 40 hours of vacation leave once per year. And we'll come up with a policy on that, determine when we want to do that. Be once per year, looking at possibly the end of the year to do that. So we talked about that at the negotiations as well, so.
And was that
across-
something that the rank and file really wanted?
I think.
Yeah, they did.
They
did.
Yeah.
Yeah, they wanted that. It's
Ask
it
about
was a
the,
negotiated item that we, you could add something and, you know,
while
or
we're at
something
this,
else.
I'd like to ask about the 15-minute. That's kind of a nightmare of bookkeeping, isn't it? And it's only 15 minutes. That's in the past, it was always a half an hour, which is still. But 15 minutes, that's. Even for scheduling and stuff for the,
But still, the supervisor still needs advance notice. It can't be just,
Right.
Yeah,
it
but-
just can't be a spur of the moment kind
yeah,
of thing
well, yeah, but. Just those little 15-minute ones are hard to,
to administer.
yeah,
Yeah.
saying, okay.
Well, we'll administer it. Page 7, this is on sick leave. That's been changed also to a 15-minute increment as well on that.
It's because the other contracts had that same language. and
same
they wanted them to be
languages.
the
I
same.
know. Then they should have went to 30 minutes, the other contracts.
I think they were, and they switched.
Okay.
Page 8, item 10, apparel, the payroll, the allowance for clothing was increased from $225 per year to $350 a year in 24, and also $350 a year in 25 to match up with other unions as well on that. And no changes on page 9, page 10, 11, 12, 13, 14. Would be the pay plan on page 20. This is gonna do our wage and time study. So it's all the rates are there for all the different employees. And one item that was changed, an employee specifically assigned the highway maintenance worker intermittent foreman position, I believe was $1 an hour on previous contracts, now been raised to $3 an hour for that during the duration of the assignment. And 2025 pay rates would be a 4% increase over the 2024 rates. This is a
What's the-
2-year contract.
What's the pay rate from 23 to 24? What was the increase?
Between 11 and 17%, depending on the job. Approximately.
And approve them separately.
Yes.
Any discussion? Anyone want to
I'd
make a
move for
motion?
approval.
Thanks, Luke. Is there a second?
I will second.
Seconded by Dan. Any other discussion? Thanks to the committee that was involved with that. Kathy also, I guess. All in favor, say aye.
I,
All opposed, same sign. Carried.
The unions prior to us have already agreed to the contract as well, so. We'll just be authorizing signatures at this point after approval.
Okay.
Okay. Chairman and board members, the next one you have is the courthouse unit of local 2424 AFSMI. Double check, make sure you have pages.
yes.
Yeah, okay. Thank you.
Yep.
Okay, this includes the courthouse employees, also the emergency services responders at EMS as well in this organization, this group. First changes on page 4. Item hours of work of overtime. Employees who work more than 8 hours for election duties on the general election in November will receive time and a half. The employee's regular rate of pay for all work hours beyond 8 hours that day. This would be for employees in the courthouse who are assisting with elections on that day. So if there's excess hours that day, they'll be paid about time and a half past normal working hours.
Does that include the primary?
No, general election only.
Okay.
General election only.
Don't they normally get overtime?
Apparently, some did and some didn't, depending on their day, what their work hours were. So we cleared it up. Everybody's just gonna get time and a half beyond 8 hours that day.
They said sometimes it conflicted with Veterans Day where,
Yeah.
and holiday hours don't count toward
Right,
overtime.
Oh, they go by 40 hours?
yes,
The highway department goes by the day.
yeah, it goes by 40 hours.
No, well, the highway goes by
Yeah.
over the normal work hours.
Yeah, the issue is holidays is where it came into play, like Luke said.
Yeah, but that is different than the highway
Yeah,
department.
so they're also working, this is just a general election, 1 day per year. So not all the same.
Well, before they were, but for the 15 minutes, they were the same.
Yeah. Again, this is a negotiated item and it was agreed to by the unions to do that, so, and wanted to make sure that they were compensated for their time at that. Page 5 is Juneteenth. That's the holiday that was put into effect, that went into effect last year. Page 6, maximum, says a deletion, there is no vacation leave shall be granted during the first 6 months of service, but upon satisfactory completion of such period, vacation shall accumulate for the full time served, so people can start using their vacation when they're hired, instead of having to wait 6 months before they can take their first vacation.
But do they have to have hours on the book before they can take it?
Yes.
Okay.
Yeah, can't take vacation that you don't have. Yeah. On 7, again, same as on the highway, employees with at least 120 hours of vacation time accrued may cash out up to 40 hours of vacation leave once per year. And we'll again come up with a policy on when that will occur. Page 8, sick leave used in 15-minute increments as well, same as the highway department. And beyond that, changes, page 23 is the next changes. That again is regarding uniforms, EMTs and paramedics. And their 24 amount will be $350 and 25 will be $350 for those two contract years. And term of the agreement is January 1st of 2024 through December 31st of 2025. So it's a 2-year agreement with this local as well. Signatures on the back, and then you have the pay plans on the very last page, page 4 and 5 at the back. With the adoption of this pay plan, employees are not eligible for anniversary steps in 2024. That's across the board. There are no anniversary steps in 2024 for any employees because of the adoption of the pay plan that went up substantially due to the wage and hour study we did. And on page 5, that also reflects the same 4% general wage increase effective January 1st of 2025 for those jobs within this local.
Was that an 11 to 17% range too?
Yes, everything was in the same 11 to 17% range.
Mr. Chair, I'll move that we approve the union agreement between us and the courthouse unit.
Okay, is there a second to that? There is a motion and a second. Any other discussion? All in favor, say aye.
Aye.
All opposed, same sign. Carried. Once again, I want to thank the people that were a part of the negotiating team. It's good to have it signed.
Hey, Mr. Chairman, I'll get signatures. So we can get them back to the union and to the. Thank you for that.
We do closed session and then committee reports. Bye.
Yeah, make a motion to go to closed session.
Yes, it is. Mr. Chair, I'll move.
Okay, is there support for that? I'll second it. I'll second that. Any other discussion? All in favor, say aye. Aye. Opposed, same sign. Votes from the peanut gallery do not.
You guys never get in trouble. You're always doing the right thing.
We meet the second Monday of every. So come on down.
If you ever seriously need me because you have an issue, contact me.
Appreciate that.
Thanks to me.
And we'll see ya. Have a good day.
Thank you. Who wants to start committee reports? Or you got some more to say?
Yeah, I do have one more thing that I forgot about earlier.
The chair recognizes Nick Berg, highway engineer, Supreme.
March first, we have a bunch of scheduling conflicts in our office. So there's gonna be anybody there until probably mid-afternoon. We could have say maybe taken something farther away, a meeting farther away or something that would cost more, but like, I know it's kind of weird, kind of came together like that, but either way, so if you try to get a hold of us March 1st, this Friday. You might not get anybody till mid after. I don't like that, when the office is closed, but what else, what else do we do? So I just want to make you aware of that. We're not ignoring people. We just.
We'll know what happens when somebody reports to us that they can't get hold of the highway department.
Yep, if it's
They're
that day,
continuing education. So
yep.
Is there,
Training day?
is there a voicemail possible or not?
If they call a direct line, yeah, but the office one doesn't have
We
Have a-
could say we're out of the office.
right, we don't have that, no.
Oh, you don't.
But if somebody would say, call it one of the direct lines, like someone's desk, then yeah, absolutely, then it'll show up on email and.
But the highway workers will still be available for snow removal, because it is March.
It is March, yep. So if somebody stopped in with,
60
It's
degrees.
just engineering department?
correct, yeah.
Yeah.
Yeah, so if somebody knocked on the office door, it'd be locked. If they walked around to the shop door, then someone will be there to help them, but it's just,
That happens.
it does happen. I don't like it, but I mean, that's kind of,
That's what it is.
that's how it turned out, so.
Yeah.
But yeah, part of the day this Friday, nobody will answer if they call or stop, so. And we can probably put a sign on,
Put a sign on the door. And you've got voicemail, right?
yeah, on the direct lines. So just wanted to make you aware of that if you get a it was and what time, so. So,
Thank
Alright.
you for keeping us informed.
Yeah, appreciate that.
have a good day, everyone.
See you later.
I can kick them off if you want.
Go right ahead.
You bet. February. On the first, we had our Prime West meeting up in Alex, both Doug and I. Again, we touched on a little bit earlier, again, the bank-based purchasing contract lawsuit, as we talked about before the lawsuit, we're hoping to hear something. I thought I understood from what Jim Prisman told us, though, that the Supreme Court still doesn't have to take this up. They can still refuse to hear it, I think, don't they? Maybe I misunderstood that.
No, I think you're.
Or do they
I think
have to
you're
make a
right.
decision?
I
Was
thought they
that,
had
was that,
taken
the-
it out.
maybe that was the last. one
That was
they
the
had.
last one, then they decided to take it, that's right. Yep. Then on the second, my granddaughter was born, well, that doesn't matter.
Oh, yeah, that matters.
Yes, not to you guys, it doesn't. So I was out of the area all that next week. So then the week of the 12th, on that Tuesday, the 13th, we had a regular board meeting at the hospital. We had our plan ops meeting. And again, thank you, Luke, for changing that for me so I could be at it. So that afternoon, we had Explore Southwest Minnesota. Chris was able to attend that. I wasn't able to attend that Southwest Minnesota. I had in the evening, I had a meeting back up at Alexson for quality control for Prime West. On the 15th, then I had a Southwest CERTS Regional Development Commission, and it was just a committee meeting for the CERTS, the clean energy. Then jumping down into Tuesday, the 20th, we had our pipeline safety meeting here that we had hosted. We have gentlemen from Magellan come in, and Magellan notified us that they now have been bought out again. And now the new name of the company, it ends with Oak.
One Oak.
One
One
Oak.
Oak.
Yeah,
One Oak.
One Oak.
Yep. And they are planning on some more public hearings and looking for a little bigger venue. I think they're gonna contact the art center, see if they can have
They
it
said they
there.
were gonna use the lodge.
Yep.
Right?
Lodge.
Yep.
As of yesterday.
Well, they
emailed
did
us.
settle on the lodge?
Yep.
Okay, I didn't see that one. Good. I had bad reception out on the lake yesterday. On the following day, then the 21st, our regular Southwest Health and Human Services up in Marshall, Beth gave a very in-depth report of what we're doing there. Said the finances were doing real well on that. Following day on the 22nd, Thursday, I had a clean energy idea meeting, and that was a Southwest RSDP. It was just a review of various updates on some of the clean energy items that they're working on. On the 23rd, I had a finance committee meeting then with Health and Human Services. And that was when I talked about before with the funeral directors.
A nice February report.
That was a nice February report. Am I in the wrong month?
Yes.
Yeah, we haven't done January.
We're a month away. Well, my granddaughter was still born. On the 4th, meeting. On the 9th, we had plan ops meeting. On the 10th, Wednesday, we had our SMOC meeting up in Marshall, and that was a planning discussion meeting we had. Had a presentation from Mike, I cannot pronounce his last name, Duscher, D-U-S-C-H-E-R. On the 12th, Southwest 18 Mental Health Consortium, I wasn't able to make that meeting, but that's the one where we talked about this whole thing with the joint powers agreement. And I think we told you about how Lincoln and Lyon County aren't actually part of the 18 consortium. So that's going to get rectified at this new joint powers agreement. You'd let me go through the whole month before you corrected me.
When you said January 1st, you were somewhere and I thought, what, New
Nope.
Year's Day, you were somewhere?
No. On the 24th, Doug wasn't able to be at radio board. I went in his place. First time I've been to a radio board meeting for years. And basically they talked about, I had some notes on that as well too. There's a certification process now for dispatchers. One of them, of course, is being able to give CPR instructions over the phone. What Keith has done here, though, instead of us having our people trained for it, we've got a third party that we contract with. So if that comes up, we notify them. Another certification training they had for dispatchers. But in any case, the board, the radio board has decided to table that. They're still doing more discussion on that. They're not ready to enter into agreement for those certifications. On the Thursday, 25th, I had an ACE meeting then over at Slayton and went through some items with our contracts with our employees as well too. And we're making recommendations to increase salaries for our ACE coordinators. And in fact, we took action on that. I think we did like it varied between $2 and $2.50 an hour increase because some of our different ACE coordinators had different levels of experience and background when they came into position. So not all are paid the same. Also, we agreed to go ahead and make a assistant position then for our main coordinator, Michelle. And there's an individual in Redwood who wasn't able to continue to be a local coordinator because of childcare issues. But she is available to do some supplemental work as an administrative assistant type thing, so we were able to make that change. On the 30th, we had our special law enforcement liaison meeting. Keith had gave us update on that. There's some discussion with Dan Delaney, at that meeting and so forth, and a few things got aired out. Then on the 30th, we had our open house. That was the extent of my report for January. So now you know where I've been. Sorry about that, guys.
Who's next?
I'll go. For January, on the second organizational meeting, fourth, Prime West Health, Dan and I. The 11th and 12th was the Minnesota Hospital Association Winter Conference. 17th, Southwest Health and Human Services. On the 18th, Soil and Water Conservation District. I'm not sure if this was mentioned, but they did order a new matting machine. Do you see? Yeah, okay. I didn't know if anybody was aware of that, but 22nd, CPT meeting in Morris. I'm the alternate. Chris couldn't make it. So that's the first time I'd been up there. The 23rd, the 30th, special meeting, with the highway or, with the lawsuit with the highway department. And then the normal PCMC and regular board meetings, of course. February 1, Prime West Health. Again, on the 8th, February, Soil and Water again. 20th of February, meeting on that pipeline routing. 21st, Southwest Health and Human Services. And then the PCMC and regular board meetings. Yeah, go ahead. Luke?
On the 9th, I had plan ops. On the 10th of January, District 8 land use, I was reelected chair. And the number of counties around us have wind and solar projects going up. But feedlots were kind of slow this past year. On the 11th and 12th was at the hospital conference where Doug was recognized for completing the fast track certification program, and Dan will be recognized this summer for completing the advanced certification. On the 13th, they completed the Board of Appeal and Equalization training. On the 17th, we had the special hospital meeting to review the community survey results. On the 18th, Soil and Water District. On the 19th, I had AMC board meeting where Todd Patzer was chosen for a NACO position to replace Lisa, who became the new secretary treasurer. On the 22nd, at the regional solid waste meeting, I was reelected chair and ended up sending a letter to PCA requesting a 3-year extension in our 10-year plan, since they don't know yet what demo rules will look like or when they will be implemented, and I'll have more on that coming up. On the 23rd, the hospital board. On the 24th, Highway 23 Coalition, we approved hiring Bolton and Mink to work on some various congressional and legislative grant proposals. Had that special board meeting on the 30th and the open house at the environmental building. February 1st, had Area 2 and RCRCA in the morning, and then in union negotiations in the afternoon where we got a tentative agreement on both contracts. On the 5th, had an executive meeting with MRC. On the 7th and 8th, I was at the AMC Drainage Conference. That's really good. A lot of good stuff. On the 9th, Highway 23 projects meeting, we worked with engineers from various counties to ensure that MnDOT won't oppose our requests for funding. They won't support them because they're told from above that we're not in favor of any expansion. But if we can figure out a way to get the money, they'll do the work, because they're told to basically, but we just didn't want them to at least oppose us. On the 13th, I had plan ops at the hospital again. on the 20th. I went up to the legislative conference. I observed the AMC legislative testimony training and then had MRC later that evening with two DFL senators presented to the group and took questions, and we had updates from Rob and Sam. On the 21st, the research committee met and we reviewed the draft cannabis guidance document. They're still adding a bunch of stuff to that, and then had a brief discussion on homelessness, had updates from our policy staff. We went and visited Representative Schomacher, heard from the Commissioner of Revenue, Markwart while we were at lunch. Steve and I got a Nooks and Crannies tour of the Capitol with somebody who works there, and that was very nice. And then we visited Senator Weber. And then on the 22nd, at the Environment and Natural Resource Policy Committee, heard from MPCA Assistant Commissioner Kirk Kadelka, who acknowledged that demo landfill rules will be delayed till at least late 2025, which should tie in good to that 3-year extension we're asking for a 10-year plan, because obviously if they're not even gonna do anything till late next year, we shouldn't be expected to have a plan by June of this year. And then I questioned him about waste energy, and he claimed that in 2 legislative reports, he mentioned that it was still better than landfilling and should be used going forward. Although then he said something about in a socially equitable way, and that, because of course they want to shut down the one in the cities. I don't know how that's gonna work for him, but then John Jaskey from Bowser was surprised to hear that he was mentioned in this bill that's being proposed requiring registration of all tiling with a $50 filing fee, to the recorder's office, $42.50 of which would go to Bowser. And he's like, well, I didn't even know that they were tasking me, proposing to task me with this duty. I don't want this duty. If you can figure out a way to get me out of it, please do. But I just thought it was interesting that they would, propose something that seemed like an overreach to begin with, but then not even clue in the people tasked with doing the work.
Definition of being thrown under the bus.
I kind of, but I know he's one of the, I think, the easiest agency directors to deal with, because he kind of gets, our issues and is more open to, working with us rather than just telling us how it's gonna be. And yet, to see that they just kind of throw him under the bus, for something that they know is gonna be controversial, that's kind of a bummer for him. And then when DNR Commissioner Sarah Stroman spoke, they passed out a pretty thick document about their new plan for Timberwolves. Which of course, they're trying to balance having enough to keep the population going versus not having enough that they're eating people's cattle or whatever. And then ironically, the day before this, I had seen on TV, I had heard anything about it. We're potentially facing a feral pig invasion from Canada.
I have read about
I
that.
heard something about.
And I mean, it's very serious. There's like over 1 million square kilometers, or about over 500,000 square miles, Canada that's already infested with feral pigs. And they're less than 40 miles from Minnesota.
Now, are they supposedly as aggressive as the ones down in
Yes,
Texas?
yeah, absolutely.
Yes.
And they showed on the news, they were talking to farmers in Manitoba that were watching 25, 30 of them, running down the road in front of their tractor and, trying to dig into their feedlot, eating their cattle's feed. And
If we had more timber wolves.
well, I asked that question next. Do wolves potentially eat pigs, or can they? But they didn't give a very good answer at this session. But I've talked to people since, and some claim that they think they may not, because of course the boars are big and have tusks, and they're,
They're pretty aggressive.
and the skin's pretty thick, so they're not gonna be as easy eating as a deer would be. So they're questioning whether they could even take one or, but I mean, we certainly don't want feral pigs coming into northern Minnesota, cause I mean, they can destroy like 1 to 3, 4 acres in a day. Cause they just come with their buddies and trash out several acres and.
You think with some of those vast tracts up there of just scrub timber and swamp and bog, it'd be a perfect environment for them.
Right, but I mean, once they're in, you couldn't hunt them fast enough, cause they
Mhm.
reproduce quickly and they're smart, they hide and whatnot, and. I mean, hunting alone is not a solution, and they point to Texas where there's over 3 million of them and
Mhm.
we can't seem to get rid of them. And then, closed out the day by having our AMC board meeting and, of course, we were told at MRC a couple days before that, one of the DFL senators, acknowledged that he was not gonna support that North Star Act or the Sanctuary State Bill or whatever. So we know it can't pass. But yet, they have other proposals related to immigrants coming forth. And, while AMC did not want to take a position on immigration as, none of us would, because it's not in our lane. But, they did want to acknowledge that, for the immigrants that are already here, we need federal funding and that type of thing. And obviously the federal government needs to address immigration. It's been going on for decades. Obviously, both sides of the aisle haven't done squat about it for years. And basically it was just a statement to that effect that, they need to act and fund what they've already created and left it at that for you. And that's all I have.
Thank you. My report is just for January, January 2 organizational meeting, 9th regular meeting, 11th, 12th, the hospital conference, 17th was Plum Creek executive meeting. 22nd, Rural Minnesota Energy Board, 23rd regular meeting, hospital meeting. 24th was a TAC meeting with about buses. Fun fact about that is we got a new bus or two, I think, that were ordered in 2020, and we paid regular price for them. They got one ordered from 21, it's gonna cost 93,000. When we ordered in 22, it's gonna be 120,000. And if we order one in 23, it was 185,000. Doubled in 2 years.
That's real inflation.
That's real inflation. This,
One good news that came out of that, though, they are starting to consider getting smaller vehicles instead of having to go with those great big buses.
well, and the benefit with that would be you get a bigger pool of drivers.
CDLs aren't
You
required.
don't need the CDL.
Right.
Which is a really tough thing for guys
How
that are
would they
working
be under?
part-time.
Don't you have to be under, for passenger, you have to be under, even a big van you need. Or the van is, what is the rules?
I think
Like,
it's
is it-
van qualified for just a class B or whatever. From what I understood.
That's what Nick said.
Is there something for passenger though, when you're,
There's a school
You have
bus
to have
endorsement.
the
well,
endorsement.
26,000 is the B, the
Yeah.
cutoff for the B, but then there's, for passengers.
Yep.
Okay.
And I think that's why for our bigger existing buses that we got now, they have to have the CDL with the passenger endorsement. But with this other size they're talking about, it's a small enough occupancy that they don't need to have a
Oh, okay.
CDL.
It's below that.
That's
Okay.
below that.
Okay.
It might still need a school bus type endorsement, but that's better than easier than a
need a full CDL.
Don't need a
CDL.
CDL. Yeah.
The other thing was kind of frustrating, maybe we mentioned before, if you've got somebody who's had a CDL license for years, they just didn't happen to have a passenger endorsement. And years ago, if you needed an endorsement, you could just go and take the endorsement itself. Not anymore. Now you have to start from scratch. It's ridiculous.
They also had some more talk about the gold route and getting buses back up to shape and hopefully if they could find enough drivers, they could start it this summer. 29th was planning committee meeting and 30th was open house.
Luke, were you telling me the thing with the flag that now was telling me that we don't have to have, the only place in Pipestone County that we would have to have the new flag is in the court.
In the courts is what
In the
I was told.
courtroom itself. Yeah, that we can still keep the old one.
Well, you were mentioning some other
And the only
people or something.
office that has to abide by the new state seal would be the recorder's office.
Right.
So we,
There's a couple of commissioners yesterday that said they've had 30, 40 people at their meetings the last couple of times.
Oh, flags
Up the flag.
or the, yeah.
That was in Redwood County, I think,
For it or against it,
against the flag, against the new flag.
against changing it, yeah.
But again, like Luke had mentioned.
We
too,
can't impact that
it's
decision.
not
No,
our wheelhouse. We don't have the governance decision.
but like, Steve was saying, we can do minimal changing.
Don't have to buy a new one for here.
oh, we can leave it just the way it is.
Whatever you do outside your county buildings is up to the county.
Yep. And even we learned through even badges, like law enforcement badges that have a semblance of the seal like that or whatever. There's a lot of different variations of this seal. They don't have to change theirs as well. There was a big, fuss going on. Everybody's gonna spend, thousands and thousands of dollars changing every badge and every decal on every car and all that.
Well, that would add up.
It would if you had, I don't, and the state's not requiring that to be done, so
Good.
made it clear that they'll fly the flag on their state facilities.
Next meeting is March 5, Road and Bridge, and the next public regular meeting is the 12th.
Correct.
I will not be at the one on the 5th.
You're gonna miss Road and Bridge?
And we got a cataract surgery that day. Aren't changing that, so.
5, 12, and 26 for meetings for March.
Anything else come before this board today? Is there a support?
Second.
All in favor, say aye. Aye. All opposed, same sign. Motion to adjourn carried.
Do you see my Valentine?
No, there you go. All dark haired
Close
sweet.
off here, you guys.